All right, Aaron, thanks so much for being on this podcast. I appreciate it. My first question that I have for you is tell the audience a little bit about you and how you got started in the work that you do today.
Okay. Yeah, perfect. So I am currently a chiropractor. I'm more of a sports chiropractor as of right now. I got into this because I've always had a passion for fitness, for movement. I was always playing some kind of sport. And so I got into some type of movement major. I didn't know what I wanted to do in undergrad, to be honest with you. I don't think really anybody does. So I ended up just getting like an kinesiology major, and actually started cardiac rehab of all things from that. And so I worked in the hospitals, outpatient and inpatient, for heart patients, kind of after you have any type of heart attack, stroke, stents, bypass surgeries, things like that. And then I decided I wanted to do more. I wasn't sure what, so I was always a personal trainer on the side. I loved coaching. I loved helping people, showing people what they're capable of doing, what they really can do. I mean, there's so many people out there that just don't think that they can do possible things. And I just felt like I was that vessel to help them. And so coaching, I've done that for the last 10 years. It's always been on the side. And I really wanted just to bring them all together, right? I didn't know what. I was thinking maybe physical therapy. I never even thought about chiropractic. But COVID happened. And
Mm-hmm.
our gym's closed down for 2 months. Luckily, I'm in Texas, so it didn't close down for too long as some other places. But it really kind of pushed me to figure out exactly what I wanted to do. I knew I probably was going to have to go back to school, which school was no problem. I love education. And so I was working as like a PT tech at a chiropractic office. And he was kind of just like, why don't you go to chiropractic school? He was like, you can coach, you can do PT, you can adjust people, like you have like that higher level to kind of do whatever you want. And luckily we have a chiropractic school in Dallas, where I'm at. And so I said, okay, I guess this is what I'm going to do. I was almost 30 years old, so I had been out of school for 8 years. And I was like, let's give it a shot. And 3.5 years later, I graduated, and then now I'm kind of finding my way of how I want to do chiropractic because there's lots of different avenues that you can go with it. So I'm kind of navigating how I'm doing that and kind of how I'm doing it differently than a lot of other chiropractors.
Mm-hmm. So what is sports chiropractic? I've never heard of that.
So sports chiropractic is more based on the movements, more rehab, more corrective exercises. So regular chiropractic, there's some people that just kind of do adjustments. There's some people that do adjustments, soft tissue, other modalities like decompression or laser or shockwave, things like that. Sports chiropractic, it entails the whole corrective exercise portion of it, right? For an adjustment or soft tissue, those are very short-term relief kind of things. And more of the long-term relief is doing the corrective exercise or the PT that's going to hold a better pattern over time. So I just do a lot more of the movement-based work, right? And trying to get your body to function fully together as one piece rather than just hyper focusing on one pain area.
Mm-hmm. So, because what I was going to ask is how does sports chiropractic differ from like physical therapy? Because I've known, I've known physical therapists or I've had physical therapists in the past who I've worked with. So how do you differ between the two?
Honestly, it's not that different. We go to school for the same amount. I will say PTs, their main focus has always been the corrective exercise, things like that. I do have the ability to adjust the body, so I can put into like a bigger thrust into the body to be able to move things. So I do have the opportunity and the option to do that. I will say about half my patients, I actually don't even adjust because I have found more of the corrective exercise has had a bigger impact on people. So to be honest with you, there's not a lot of difference. A lot of my colleagues are actually PTs, and a lot of what I learned from to today is all from PTs as well.
And so what kind of population do you work within the sports chiropractic realm?
So right now, just the general population. I am a trainer at an F45, so a functional 45 gym. So a lot of my patients are actually my F45 members that currently go to the gym. So most of them are pretty active already. They have a good base of understanding what exercises, they've been through exercises and such. I do see some adolescents that play sports, right? I have a couple gymnasts that I treat and build programs for. So generally, I've adjusted as young as a baby, and I've adjusted all the way up to 85 years old. So I have done the whole realm of population, but my main population is kind of just the average active adult that's kind of going to the gym.
hmm And you said you also do personal training on the side. So like, is that different from what you do as a sports chiropractic, or how does that work?
Yeah, so as a personal trainer, so I am an F45 trainer, so we do class-based functional fitness. And so I go into my regular shifts for those. I coach, I demo, I do everything with that. It has been very interesting trying to separate the two because now everybody knows my knowledge and what I do. And so a lot of people will come up to me after class, before class, trying to get advice, things like that. Sometimes I have to set some hard boundaries with people because, I'm like, I haven't done an assessment on you. I don't want to give you mediocre stuff that might not be pertainable to you. So I generally try to see a lot of those people outside of there. But yeah, I just do group classes 3 times a week. So I do about 7 classes a week just as a F45 trainer. But it is starting to blend very well with like my business.
Do you just do group classes, or do you do more one-on-one?
I used to do more one-on-one, but I will say I do group classes now because everything is kind of already taken care of for me. It was a lot easier to do school with group classes because I wasn't programming. I didn't have to create any of the stuff. Right now, I am doing more of that online. So I do a hybrid style practice. I see people in person 2 to 3 times a week, but I also am online now, and I'm writing one-on-one personalized rehab based off an assessment that they do with me over the video chat. So I can see a lot more people from anywhere in the United States, outside the United States, and that is more one-on-one personalized training and rehab for that person, but it's all via like a telehealth.
hmm What have you learned in doing this kind of work, both in the sports chiropractic, but also in the personal training aspect?
Oh my gosh. I have learned so much in the last 3 years. I almost feel like I can't hold any more information, and I'm constantly learning. Like healthcare is constantly changing. There's always some new research coming out. There's always somebody telling you this or that. There's so many people out there telling you different things. There's so much continuing education that I do. But I have learned so much from the chiropractic side on just how the body actually should move and why it moves. And that has made me an exceptional trainer in the gym because I do have all of this extra knowledge and of just how the body works and what muscles should be moving and maybe where do we have deficits and imbalances or things like that. So I will say I've learned so much more about the body and how it works holistically all together versus just kind of, okay, it uses these muscles, uses that muscles. This is how you do it. This is why. I actually know more of the why behind things, I feel like.
hmm And is there anything that you'd like to learn in terms of something new, either in the sports chiropractic side or in the personal training side?
Yes, there's a whole to-do list of things that I would love to learn, but I'm very intrigued in prenatal and postpartum. I have quite a bit of patients and clients at F45 that are either trying to get pregnant, are pregnant, or coming back after pregnancies. So that is one niche that I would like to into a little bit more. I myself have not had any pregnancies yet. So I don't have the personal journey behind that or the actual, I guess you should say, experience behind
hmm
it. But I've had so many females come to me really needing that education, and really needing some rehab after having a child. So that has been a big one that I've started to kind of go down that road a little bit more. But of course, with that comes so much more on the learning side as well.
Hmm. And is there some sort of mentor that you looked up to and said, I want to go into sports chiropractic, or I want to be a personal trainer, that you're like, I want to be like, this is a role model that I could sort of envision in my own professional career?
Yeah. Yeah, actually, it was a sports chiropractor that he is here in Dallas. His name is Dr. Travis Mann. One of my best friends from school, she's an associate doc there, and he is the one I actually went to for my own hip issues. Of course, us chiropractors and healthcare professionals have all of our own injuries as well. And sometimes you just need to look at it from a different lens. And it was really starting to affect my daily life. So I went to him because I knew he had 15 years experience, everything like that. And when I went there, I was like, oh my gosh, this is how I want to do it, right? This is really what I want to do. How he was structuring everything. He spent a lot of time with people. He went through exercise programs and progressions, gave you homework. It wasn't just like a in and out kind of thing, which I used to work at a clinic that was like that, and it really kind of changed my perspective of like, oh, you want to spend time with people. You really want to get the whole picture because what I do with you in a hour session is very minimal compared to what you're going to do for the next week, 2 weeks, 3 weeks, right?
Hmm.
And then online version, um, there is a PT that actually her name is Taylor Cannon. She has been a big mentor and role model because she is changing the online rehab. She is kind of seeing like the healthcare system that's kind of broken here in the United States, and she was kind of burnt out from seeing 3, 4, 5 people at a time, not having the amount of time she really needed with people. So she developed a entire program online and actually allows a lot of chiropractors or physical therapists to use her programs and learn from her to really help a lot of these people that need help.
Mm, that's cool. So my last question is, what tips or advice would you give to those who want to do what you're doing, who want to get into like personal training and or sports chiropractic?
Yeah, I would say just don't wait. Just do it. I mean, I waited so long trying to figure out what I really wanted to do. Instead, I knew exactly what I wanted to do from the get-go. And I wish I hadn't waited as long. Even 30 is not that old, but in comparatively, like I just wish that people would just kind of go for their dreams, instead of being scared to go for it, right? You have to just take a leap of faith and you'll figure it out. Like, I don't know what I'm doing half the time. I didn't know what I was doing a year ago. And I will say that the only way for you to learn it is to actually do it. And you don't need to be sitting on the sidelines, kind of just watching the years go by. So I would say just go for your dreams and it will make you so much happier. I promise you that.
Mm-hmm. All right. Okay.